Hi, listeners. Welcome back. I have a fascinating interview today that I want to present. My guest today, her name is Simona Francese, and she is a professor of forensic and bioanalytical mass spectrometry. That is a mouthful for me, at Sheffield Hallam University in the UK, in the United Kingdom. She holds a degree in chemistry obtained from the University of Salerno, Italy, and she achieves that in 2000, and a PhD in chemical sciences awarded in 2004 by the same university. In her current role, she is deputy head of the Center for Mass Spectrometry Imaging. I think I got it right this time. She's an expert in the development of multi-MS imaging. We're going to dive into that in just a bit. Multi-MS imaging applications, and has pioneered its development for the analysis of latent finger marks and blood to profile offenders. Now, in the word of offenders, we're going to discuss one such offender today: cancer, related to Simona's work. More recently, she has engaged in research at the interface between forensics and clinical diagnostics using sweat in fingertip smears. Her research has been implemented in police casework in the UK and Europe, and has been partly funded by the Home Office, West Yorkshire Police, and the Defence Science and Technology Laboratory in the UK. She engages public dissemination at all levels, and one recent endeavor was delivery of a TED Talk in Vancouver on molecular fingerprinting. Now, Simona and I met in early September in 2023 at the London Breast Meeting. What I quickly learned is she was a great partner to navigate the underground tunnel or train in London. So I'm so pleased to have you on the podcast, the YouTube channel, however we're going to repurpose this. I would like the listeners to know that when I find out information like this, it is very important for me to kind of get it out in the public on my channel. So, Simona, thanks for joining me today. It's really good to see you.
Thank you so much. It's really good to see you. And honestly, I'm really honored to be here speaking to you and being on your podcast.
Well, great. I want to get going. You launched the London Breast Meeting. You were the,
Yes.
and I thought it was so powerful that they started with your presentation because it's such a fascinating topic. So I would just like you to begin. I know that you brought some slides today to share with us, and you kind of had this serendipitous moment in this discovery. So I'd like you to start out by telling us about that, and feel free to share your slides today.
That's very true what you said. I did suffer for a long time before starting my presentation there of the imposter syndrome. I didn't know why I was even opening that meeting, but it turned out to be a great experience. And I was really honored to be able to share this research. So I'm going to start sharing the slides so I can explain to the listeners how serendipitous this discovery was. So you mentioned in the introduction that the bulk of my research really is in forensics, and I'm a forensic analyst, and we've been developing this technology. There's a type of mass spectrometry to be able to provide information from fingerprints that will help the police to catch the suspect. So you say the word fingerprint and everybody imagines or has in their mind exactly how they look like, and the police uses the very different details that we have in our fingerprints to uniquely identify a person in a database. But really, where we started from over 15 years ago was, from the very beginning, what is really a fingerprint? And I think this video is quite powerful because it shows what really a fingerprint is. We think it's just the pattern of lines, but you can see here the formation of sweat in our sweat pores. And as we make contact eventually with the surface, we leave a fingerprint. So now a fingerprint is no longer just a pattern of lines, but is a pattern of lines made out of molecules. And we have all sorts of molecules there. So if obviously we're transferring sweat, so we will have molecules that are produced in our body, and then they are excreted in our sweat, and therefore they end up in a fingerprint. We have those molecules that are kind of transformed. So you eat food and drink drinks and have your medications. Some people would have recreational drugs, and those are transformed in your body, but they can still find a way to get out of the body through sweat. So you can find those as well. And of course, everything else that you touch during your daily activities will be there too. With this kind of molecular information, we are not just able to use them and visualize them. So it's like we can really see where these molecules are distributed on these lines of the fingerprint, so that we can provide images of fingerprints to the police, sometimes better, in a better way than what they can do. So we can help them identify a suspect on the physical side of things, but actually we can use this molecular information also to profile potential offenders or suspects. Because, for example, we can infer from the molecular content in a fingerprint perhaps some actions that have taken place prior to or during committing the crime. And so you can start maybe excluding some suspects from your pool of suspects. And then, for example, in the non-distant future, we might be able to delve deeper in dietary habits. So it is very reasonable to think that the molecular composition of a fingerprint is very different between meat eaters and vegetarians, for example. So again, you could continue to exclude suspects from the list. As I said, we can see the presence of drugs and medications, and we can provide other types of personal information. Everything is narrowing down this pool of suspects, even to the point that we can assess somehow the state of mind of an individual. For example, if we have determined they've taken drugs of abuse and what combination of those they have taken, with the hope that eventually the police will concentrate on a suspect, their investigations. And it was when we were looking at the type of personal information that we can provide that this breakthrough came about. So we, in this particular study, we looked at a smeared fingerprint. So we wanted to take away the biometric element out of it. This is just easier when you apply to ethics. There's one less thing to worry about. We wanted to prove the concept, and therefore we took fingertip smears from a range of donors, and we subjected them to our technology, measuring the mass of the molecules present, and by doing so, also identifying what molecules are present there. And so we did this study in 2012 and then developed it further in 2020 when we published a second time. And what you see here, these lines with numbers, they represent proteins, and they are all different proteins. And we were able to find out that this bunch of proteins actually are different whether they are present in a male or in a female fingerprint. And so what we were doing in essence was determining the sex of the donor from a fingertip smear. We did that with a 75% of accuracy in 2012, and by developing further the methodology, we have increased our accuracy in the correct determination of the sex. Now, this is the crucial moment where when I was looking through these proteins, I realized that some of these proteins actually are already reported in the scientific literature as indicators of breast cancer. So that really hit me. And I thought, right, yes, I can use a bunch of this to do the sex differentiation, but actually, is it possible that we can further develop this method to detect breast cancer non-invasively from just a smear of a fingertip. This was 2012 when we realized this may be possible. And it took me 6 years until 2018 to do this study that you see here and publish this study finally in 2023.
You
The
know,
funding, yeah.
not to interrupt, but the things that you are talking about, Simona, in the elements that you find in the fingertip proteins, being able to disseminate, differentiate in diet, all of these things, and there's so much specificity to breast cancer. So this is, I think, what really jazzed me about this. So go ahead. Sorry, I'm just,
No,
my wheels are turning again as I listen to you present this.
we had the same, we were stunned, really.
Yeah.
We were stunned because of what molecules can actually tell us. So we detect all sorts of molecules. We detect proteins, peptides, fatty acids, amino acids, but proteins in this case are responsible for this differentiation. And I think what we were also stunned about was the fact that the simple gesture of swiping your fingertip across the surface would provide you enough sample to do that. So in this representation here, graphic representation, we have exactly that. So we had recruited with the funding that we finally had and that available, which wasn't much to be fair. We had recruited 15 patients, and the oncologist we worked with had made a prior classification, diagnostic classification. So we had 5 subjects that were benign, 5 subjects were deemed to have early breast cancer, and then 5 patients that had metastatic breast cancer. And we worked to some extent blindly. So we used some of this information to subsequently train artificial intelligence to be able to then determine the diagnosis with patients that the model had never seen before. So we trained the model on some of this data, and then we asked the model, now you're on your own. These are new samples. Can you actually make that differentiation? So we took these 15 patients, we took these 15 swipes. In fact, we took 3 times as much from each one of them. And then we followed our procedure, which is a bit, sort of time consuming perhaps to explain here, but it consists of sample preparation and then analysis via this technology that I'm talking about, multi-mass spectrometry. And we ended up having 135 samples to play with our model. And we tried different models, different machine learning algorithms with different robustness and different tolerance to a low sample size. And eventually we found a machine learning model that was able to accurately classify patients with the 98% of accuracy. In fact, all the early breast cancer patients were correctly classified. All the metastatic patients were correctly classified. And only 3 samples out of the 135 were incorrectly classified. So we had no false negatives, but we had 3 false positives.
Incredible accuracy.
We are, obviously, I would have loved 100% accuracy. And I'm now thinking, why did I misdiagnose and give someone a scare and basically said, you have metastatic breast cancer or you have early breast cancer, when in fact the diagnosis, the ground truth was this person is fine. And I'm trying to delve deeper into this data now. It's not that easy, as it may seem, but it might have to do, God doesn't want that, but hopefully it doesn't have to do with the fact that this methodology, because it's a molecular methodology, may actually be more accurate. But another possibility is that those patients were young patients, and we know the mammograms may fail because of the breast tissue density.
Yes.
And so they were deemed to be benign, but in fact they had cancer. Or a third option, which still need exploration, is this may in fact have been benign patient for breast cancer, but could have actually have been affected by another type of cancer. And so this is now a matter of specificity that we have to delve deeper into. How specific is our method for breast cancer? So there is still a lot to do, but certainly this is a breakthrough and one I'm very confident in.
You know, it is a huge breakthrough, and I applaud you for this 98% accuracy. Those are very good and hopeful numbers. I also like hearing you say you're diving into the 2%. Spoken like a true researcher and scientist, Simona, with great passion, I might say. So, can you flesh out so we can understand for the listeners two things? First of all, I'm glad that you showed the complexity and the steps that it takes to develop something like this. It is high level for maybe our breast cancer viewers who don't have a background in research, but it's important that they know how complex developing something like this is, and there are true benefits. So
Yes.
I'd like for you to tell us now what you feel that those are.
So the development of such type of methodology is time consuming, and there are a lot of challenges connected to it. First of all, for as much as you would love to have an instrument to yourself, you don't, and you have to share. So there is an issue of time there. Things seem delayed because you're not as quick as you may want to be, just because you have your time, instrument time, and that's all you have.
Right.
The other challenges, of course, is that you add pieces to the puzzle of knowledge, and you do this time after time, and then you build up on the knowledge that you've just acquired, and then you want to understand why you got the result that you got, and so then you follow another line of investigations to try and see whether we can improve that result and what has given you the result that was not desirable. So there's a lot of different investigation avenue, and they all need to be explored to make sure that the methodology that you have developed in the end is a valuable service to the community that can be implemented with confidence. So research historically, and these are the reasons, takes a long time. And along the way, you are slowed down by lack of fuel, if you want to call it like this. To be able to do research, you need to fund that research. And so when you run out of fuel, everything kind of stops. And you have to find little ways to maybe keep it going. But again, it doesn't go fast this way. But in terms of the benefits, you said that you can see my passion. That's exactly what motivates me, because for as complex and long and time consuming and sometimes distressing and really heartbreaking is, when you come to a stop or a halt, the thought of being able to help people with this disease or any other disease, any other pathology, I mean, it has to be one of the biggest privileges that one can think of. The prospect of being able to contribute, even if it is like a drop in the ocean, because it is a team effort. Okay, so there might be someone else that takes over me on some, over this research for some of the aspects, and it has to be like this, and it has to be a choral effort, it has to be a multidisciplinary effort. But you have provided that little drop in the ocean, and it wasn't there before. And I have to say, this has always been like this in my research, but for this particular area of the research, now I feel very invested, because I've started to receive emails and letters from patients, and they tell me their stories, and now it's become personal to me. It's not just a matter of being passionate about this and generally want to help, but it's become very, very personal. So I now feel very responsible. And the notion that this test is painless, it is non-invasive, it is quick to do and easy to do, and that immediately contrasts with what we know, what kind of tests normally are taken, from mammograms to biopsies and very invasive methods, that I'm still saying, please do go and take those tests. They save lives. You still have to do that.
100%.
We are working to try and make life easier, but those tests are life savings.
Yes.
So need to go. But the prospect of offering patients the possibility of a first pass screening, where we test you with a swipe of your fingertip and we tell you you don't need to do a mammogram now, you don't need to do a biopsy because you're clear, that it saves the patient so much stress, anxiety. And let's be honest, there are other issues connected with the uptake of the test. So there are some cultural issues. Not everybody finds culturally acceptable to expose breasts. It's quite an undignified, examination. And truth to be told, and also there are problems connected with financial availability. So for underserved populations, actually going and take a mammogram that is not around the corner, having the money to buy transport to get there, it's not something that can be underestimated. And this is very well reflected in the statistics of uptakes in Yorkshire, for example, especially in some of those areas where underserved populations concentrate, the uptake is a lot lower.
Mm.
And so we need to facilitate and provide at least the first pass test that can be taken at your GP practice, or even better, in the comfort of your room. Because what if all you have to do is swiping a fingertip, then we could devise a test such that could be sent to your home, and all you need to do is to ship it back to us after you've taken it. So it's all of those benefits combined with the response of the patients that we're having and what we are seeing scientifically that has to drive this project to completion. Is going to take time. It's probably going to take 5 years from now. We just had a slowdown again, but we have to get there. There's no other way.
You summed up everything I was going to say, Simona, but I'm going to add something from a patient perspective. I'm going to add something from a person who has also been extremely privileged to be on a breast cancer vaccine project here in the US, having spoken to other patient advocates who have done the same thing. I know that we do not make changes, we do not make forward progress unless you have people that are passionate, who will take the time, who have personal investment. You are that perfect trifecta. So my call to action is, and I don't pretend to be that much of an influencer, but if there is one person, one investor, one industry leader, whoever is out there listening to this interview that I'm having with Simona today about this fascinating new discovery that she's made, blending forensics and breast cancer diagnoses. We're going to have her information in the show notes. Reach out to this woman if you are interested in funding this. And I want to make it clear, Simona did not put me up to this. This is me as a breast cancer patient who has had to disrobe, who has gone into mammograms, who has had more than one biopsy, to know that I could take my fingertip, and smear it to determine the type of breast cancer that I have. I would like the listeners to reach out to her if you have an interest in investing in this or funding this. I also want breast cancer patients to know that I'm doing this so that you understand the people in science and research who are working on our behalf. I was so taken by Simona's story. Not only did we talk to each other personally on the train, on our little outings in London at the London Breast Meeting, but just to hear her give her presentation there and to find out about this was so fascinating to me. I will jump off my bandwagon now, but Simona, I want to thank you so much for taking the time to share this with me today. And I hope nothing but the best for you in this research and science.
And thank you very much for giving me this opportunity. I think it is important to share and disseminate. And I have to say, the response I had from patients, it wasn't just on sort of questions on when this will be ready, but some patients actually did propose crowdfunding. They are so invested into this that, this is something that I would consider, because as an academic, you always go for research fundings to research councils. That's really difficult. It takes time. But I would consider, of course, other avenues to speed this process up. It takes too long.
Mm.
Science to be developed doesn't actually take as long as getting funding, and that cannot be right. Cannot be right.
I know. I have goosebumps. Crowdfunding, crowdsourcing, I have
Yep.
goosebumps right now, but that's how important it is to us. Again, thank you. I'm talking to
Thank you,
Simona.
Terry.
Yeah, talking to Simona Francese, the professor of forensic and bioanalytical mass spectrometry at Sheffield Hallam University. I think I got that out today.
Well done.
Thanks so much. It was really great to see you.
Thank you, Terry, and you.
All right. Appreciate your time.